My thanks to Dr. Claudia Henschel and Dr. David Jankowitz for the invitation to be speaking with you today. This is my first time back here at Mount Sinai since I was on faculty not quite 20 years ago, so it's really an honor to be back. My name is Mary Bussell. I'm CEO and founder of Trimar Strategies. We're committed to advancing equitable and sustainable financial access to screening, diagnosis, and treatments while ensuring health security for all. I'm delighted to share our lung cancer consensus statement with you today. The lung cancer consensus statement has been developed to catalyze unified commitment to enhance policies and foster improved outcomes for people at risk for and living with lung cancer. It aligns seamlessly with the UN Decade of Healthy Aging and WHO's lung health resolution passed at the recent World Health Assembly, and the UN Declaration on NCDs, which is expected to be passed by the UN General Assembly in the coming weeks after an unfortunate hiccup here in New York 2 weeks ago. The consensus statement outlines 5 core unifying principles to guide health professionals, policymakers, patient organizations, and stakeholders in improving global lung cancer outcomes. Each principle has a specific implementation strategy to improve outcomes for people at risk for and living with lung cancer. In our first principle, we're eager to see countries enact all of the commitments within FCTC and improve awareness of primary prevention, including elimination of tobacco products and reduction of environmental air pollution. In the second principle, we support the initiation of national screening programs targeting at-risk populations, enhance outreach to underserved and marginalized groups, build greater awareness of lung cancer, and ensure the needs of never smokers are not overlooked. We encourage the exploration of the unique genetic differences in lung cancer. Thirdly, we want to encourage collaboration between stakeholders to ensure timely and financially sustainable access to treatments, reducing the time between market authorization and the availability of therapies, and ensure that lung cancer clinical guidelines are regularly updated. We're eager to see the promotion of digital literacy and the strengthening of the digital infrastructure to safeguard equitable access, along with the integration of technological innovations to support people living with lung cancer. Last, but certainly not least, we want to increase the ease with which people can navigate their health systems. Our fourth principle focuses on building alliances to improve awareness, access, accountability, and action to ensure that lung cancer is prioritized. We need to strengthen health system infrastructure to ensure services are available in an equitable, timely, and financially sustainable way. Our fifth principle, we look to underscore our commitment to confront and to ultimately dismantle the stigma that continues to surround this disease by openly addressing unconscious bias throughout society and the healthcare community. We can succeed by improving awareness that lung cancer is not a death sentence. As we consider how these 5 unifying principles can be translated into meaningful action, one area stands out as both a test of system readiness and an opportunity for progress, and that's early detection through screening. Each principle finds expression here. Strong governance ensures the policy and regulatory environment to implement evidence-based screening. Equity demands that screening be accessible to all populations. Sustainable financing supports the continuity of care and system resilience, and embedding screening into primary care and NCD programs transforms screening from a specialist activity into an opportunity to advance early detection. Early detection and screening for lung cancer represent one of the most effective ways to shift outcomes. We all know this. By identifying the disease earlier, we're able to more timely treat and help reinforce public confidence in the health systems that are responsive, equitable, and data-driven. Throughout the consensus statement. And through the consensus statement, we are not only reinforcing the value of screening as a public health intervention, but underscoring its role as a cornerstone of broader health system transformation. It exemplifies what can be achieved when policy, evidence, and practice converge around shared goals. To advance progress in how we address lung cancer, we must embed it within inclusive, wider frameworks, spanning lung health, chronic respiratory disease, and non-communicable disease strategies, so that policies, resources, and interventions benefit all populations equitably. Positioning lung cancer as a critical health priority in lung health promotes early detection and equitable care for all. Lung health encompasses more than infections or asthma. Lung cancer is a critical part of this agenda. Early detection saves lives, but access remains unequal across populations, so equity must be built in. Integrating lung cancer into chronic respiratory disease strategies helps to address shared risk and inequities. Lung cancer shares risk factors and social determinants with other CRDs, such as COPD. Integration fosters holistic interventions and coordinated policies. Elevating lung cancer within NCD action plans helps to highlight prevention, detection, treatment, and cross-sector solutions. NCD strategies often focus on heart disease, diabetes, and stroke. Lung cancer must not be overlooked. Framing lung cancer as an NCD highlights both the preventable and treatable aspects, as well as the economic and societal impacts, encouraging cross-sector collaboration across health, finance, education, and social services to reduce inequities. As health professionals, we unite in ratifying the lung cancer consensus statement that was presented and ratified at the 9th International Lung Cancer Network in Athens. We presented it at the 5th Emirates Oncology Society Conference and the inaugural I-ELCAP Pan-Africa Conference on Lung Cancer in Accra. We had a roundtable during the sidelines of the 78th World Health Assembly in Geneva, and I hosted a meeting on the margins of the 80th UNGA in New York just a few weeks ago. Our next stop will be at a meeting on the margins of the World Bank and the IMF in the spring. We are moving from greater awareness to meaningful action, and we are keen to have you join us. We are grateful to the organizations who have endorsed our work, and we are also grateful to Merck for the financial support that has made our work possible. Achieving global consensus is just the beginning. We are working to promote meaningful, sustainable change. Uniting global efforts through the consensus statement maximizes opportunities to improve ensuring that the needs of those at risk for and living with lung cancer are met. The fact that you are attending this conference, whether in person or remotely, underscores that we are not complacent. I look forward to bridging the gap with you. Thank you very much.